Hi, welcome to the APTA Rally Fight the Cut to Medicare, our midday check-in. I'm Kara Gaynor, APTA's Director of Regulatory Affairs, and I'm joined today by my colleague, Kate Gillard, APTA's Senior Regulatory Affairs Specialist. Kate, we had a great kickoff rally yesterday evening, hosted by none other than you. I really felt the excitement and energy from not only our guests, but also those who tuned in. Kate, I do have to say you did an amazing job hosting, and so you'll have to come back and host other events in the future. But for those who missed last night's kickoff rally, do you want to give a brief recap of our discussion?
Sure. Last night's rally was so much fun. If you haven't seen it, go check it out. It's on the Facebook page. It's on YouTube. It was awesome. I had a blast. We heard from the CEO of APTA, Justin Moore, who gave us a little bit of history about wins that APTA has delivered on behalf of the profession, and that all of those wins required us to use our voice. And so that's why we're reaching out to you guys to try and get you to send comments to CMS. We also heard from practice owners talking about how bad these cuts are going to be if they're implemented. And we also heard from some awesome young professionals who are really leading the charge in terms of advocacy and really demonstrating that part of your job in the physical therapy profession is defending the profession and helping move it forward. So keep in mind that, today's rally and last night's rally is different from what we've been talking about before. In the past, we've been asking you to contact Congress, but right now we are taking the fight to Medicare. This is different from sending a letter to your member of Congress. We're asking you to send a letter to the Centers for Medicare and Medicaid Services. That's CMS. It's part of the Department of Health and Human Services. It's in a different branch of the government. And these are the people that actually proposed the cuts in the first place. So we've done a great job contacting Congress, but now we're trying to get 30,000 letters to CMS. So if you think you've already done what we're asking you to do, double check. Make sure that you've contacted Congress and contacted CMS so that we can hit our 30,000 letter goal. And I think, Kara, do we have a little bit of an update on where we are in terms of reaching that goal?
Yeah, thanks, Kate. So last night we reported that we'd had about 11,600 comments submitted to CMS opposing the cut to physical therapy. I can happily report that as of noon Eastern, approximately 15,000 comments have been submitted to CMS opposing the 9% cut to physical therapy. Now, it's important to keep in mind that there are other people commenting on this rule as well. Some may be commenting on completely different proposals that are included within the rule. Obviously, as you've heard, many other providers are also facing significant cuts under this policy. So those organizations have been encouraging their members to write letters in opposition to the cuts that they are facing. And then there are commenters who will support the policy. So it's important that the physical therapy profession's voice and their patients and their friends and family and colleagues have all expressed their opposition to the cut, and ensuring that CMS hears our message loud and clear that they cannot move forward with this cut in the final rule, which will be released on or around December 1st. And we've made it really easy for you to send comments to CMS. All you need to do is visit the APTA website. You'll see an orange banner at the top where it says "Tell Medicare to stop the cut," and you click "Take Action Now." It'll bring you to the APTA Patient Action Center, but really that's for everyone to use to submit comments. We have a pre-written letter that anyone can use, and all you'll need to do is enter your contact information, your name, and you press "Send Message." And it's as easy as that. It takes less than a minute. And the reason why we are really encouraging everyone to lend their voice to this effort, even if you've already contacted Congress, which we absolutely wanted you to do and need to do, but we also need everyone to lend a voice to contacting CMS, because it's incredibly important to the rulemaking process that the public participate and actually provide feedback on what they like or don't like within these proposed rules. And so why we're trying to get 30,000 comments, which is a higher number of comments than ever before, is because, one, like I said, we want the profession to ensure that CMS understands that the profession does not stand for arbitrary penalizing policies that will only serve to harm patients and providers in the short and long term. So we need our message to be loud and clear. Also, Congress expects to see individuals who oppose the policy as included in CMS's proposed rule to express their opposition through this formal process of submitting comments on the proposal. And then, of course, the louder our voice, the more comments there are, the harder it is for CMS to justify in the final rule moving forward without adjusting the policy that was included in the proposed rule. So, Kate, what do you think? What would be the key message that you want to share with our audience as to why it's so important to lend their voice to this effort?
Yeah, I think the main thing to really drive home is that doing nothing is supporting the cut. If you don't comment, if you don't take action against this cut, the government is going to assume you're okay with it. So that's why it's critically important to not only contact Congress, but also do what we're telling you to do right now, contact CMS and tell your friends and family about it. Because as taxpayers, they have a right to tell the government what to do with their money. They have a right to say, hey, there's still an opioids crisis going on. Maybe we should not be cutting the non-pharmacological pain treatment options for people. With the growing boomer population joining the Medicare enrollment, we're going to have more and more need for physical therapists, and that cutting the amount of access that they can have to physical therapy is going to cost the system more money in the long run. So CMS thinks they're saving money, but they're not. So tell your friends, tell your family, you don't have to be a Medicare enrollee to comment. You don't have to be a Medicare provider to comment. And for any providers out there who think that they're not a Medicare enrollee, or not a Medicare enrollee, but they're not a Medicare provider, they think that this isn't going to hurt them. It's going to hurt you guys, because private insurance bases their rates off of the physician fee schedule. A cut in the Medicare fee schedule is a cut to the industry across the board. Even if you're not a Medicare provider, even if you're a pediatrics provider and you don't have anything to do with the older or adult population, send your comments in. Tell your friends and family to send the comments in, because we have got to stop this cut.
Yeah, thanks, Kate. I couldn't have said it better. And just so the audience knows, APTA sent 2 letters in response to this proposed rule. We sent our second letter today, actually, a whopping 55 pages. So if you're interested in reading it, please let us know. But yeah, comments are so critical. And as Kate pointed out, this is going to impact providers in other programs. And to that point, obviously we're concerned about how this will impact veteran access, TRICARE enrollee access because of that connection to the Medicare fee schedule. And so we've also proactively reached out to the Department of Veterans Affairs and the Defense Health Agency and told them this cut is coming and you need to take action, contact HHS and tell them about concerns that this cut will have on veteran and TRICARE enrollee access among commercially insured patients, Medicaid patients, and the like. So we hope that our message today has come across loud and clear that we need you to lend your voice to this effort. Take 1 minute, send a letter to CMS, oppose the cut to physical therapy, and then tell your friends, family, patients, colleagues, peers to also send a letter. I know Kate and I have already sent our letters of opposition. So as Kate noted, anyone is entitled to send a letter to CMS and express how they feel about the policies. So if you do have any questions regarding what we've discussed today, always feel free to reach out to us at advocacy@apta.org. We're here to help. And we will see you again this evening at 6 p.m. for a closing discussion to today's virtual rally. Thanks and have a great day.